Hi, and welcome to Pharmtoberfest, which celebrates American Pharmacist Month. Today, we are interviewing pharmacists who play different roles in the health and in our community. And today, we're specifically talking to Dr. Larry All, who is a community pharmacist and a clinical instructor. Hi, Larry. How you doing?
Doing fine, thanks.
Great. Some questions that we're interested in learning about is why do you think it's important to celebrate American Pharmacist Month?
Well, I tell you, pharmacists are on the front lines of providing health care. It's really important this year, of course, with COVID. But while from a layperson's perspective, I think the community pharmacists are the most visible ones, but there are also so many pharmacists that are sort of in the background, if you will, consulting with physicians about patient care, adjusting doses, maybe researching new medications, or just in otherwise providing some kind of support to other providers. And so I think the American Pharmacist Month is really an opportunity to recognize the contribution of all the pharmacists, whatever role they play in providing safe and effective healthcare.
And how do you think proper usage of over-the-counter medicines affect the medical field or healthcare?
Well, I tell you, people often have a complaint with symptoms that can be managed with over-the-counter medications. Allergies, heartburn, constipation, pain. Those are just a few examples that I can think of right off the top of my head that can be resolved with OTC medications. And I've seen some research that shows that approximately 80% of adults will use OTC medications as their first response to minor ailments. And so this really, in my mind, helps reduce the burden on physician practices and even in emergency rooms, because you'd be surprised how many people will go to the emergency room for a relatively minor ailment. And so this allows those kind of practices to focus on more acute and significant problems. And so in that way, OTC meds can really decrease societal healthcare costs. And I've seen estimates in some research of up to $146 billion a year is saved in that way. However, we know that many people will not seek out their doctor or go to the emergency room or something like that for these minor ailments. And so the OTC meds really offer a safe and convenient way for people to get symptomatic relief from relatively minor ailments.
So in your own personal experience as a pharmacist in the community, how were you able to help with over-the-counter medication uses?
Well, pharmacists are often touted as the most accessible healthcare provider because people can just walk up to the pharmacy counter and get free advice. And so I was in that role, and that's how OTC consultations typically occur. Customer comes up to the pharmacy counter, asks for the pharmacist, and wants some advice about over-the-counter selection. And that's given me many opportunities to not only educate a person about the OTC medication itself, but also about the condition for which they are seeking some kind of over-the-counter remedy. And sometimes I can assess whether it's really appropriate to treat what they have with an over-the-counter medicine, or whether it may be more appropriate to really seek out a physician for further evaluation instead of using an over-the-counter medication. And consumers also get a lot of misinformation, I think, about OTC products. And I've been able to sort that out some. And they come in with a preconceived notion that they need this dietary supplement or probiotic or vitamin or something like that. And so sometimes I've actually steered people away from over-the-counter medications that I felt wouldn't do them any good, and they'd probably just be wasting their money buying those kind of things. And then finally, there's a number of over-the-counter devices, and I've helped many people with glucose monitor selection and education about their use, and some braces for musculoskeletal complaints, and blood pressure machines. I get a lot of questions about those as well. So just to name a few of the over-the-counter devices that I've helped people with. So I think over the 12 years that I spent in the community pharmacy setting, I've helped many people make better choices than they might have on their own.
Well, thank you, Dr. All. We really appreciate you speaking with us today, and we're very appreciative of the service that you offer our community. So happy Pharmtoberfest.
Thank you very much.
Thank you, Dr. All. Welcome to Pharmtoberfest. We are so excited to have you here with us virtually to learn about Operation OTC. Operation OTC is an operation within APhA that educates the Athens community about over-the-counter medication safety. In this video, We will discuss how to measure OTC meds, how to store them, how to dispose of them, what exactly is on an OTC label, and how alcohol consumption can interact with OTC products. When taking liquid OTC meds, it is important to measure the medication correctly so you can get better sooner. It is also important to always use the measuring device that is provided in the packaging. Using other measuring devices can lead to inappropriate dosing. Household spoons come in all shapes and sizes, meaning that no spoon is made the same. This can lead to you taking more or less of the recommended dose that is printed on the drug label.
It's important to know what's on the label of your medication. Drug facts help you understand what you are taking and how to take it safely. The active ingredients section tells you the names of the active ingredients and what jobs they do. The uses section of the label tells you the symptoms the medicine treats. Look in the warnings section to know what you should not take with this medication, side effects that can occur, when you should ask a doctor, and other important safety information. The directions section of the label tells you the dosage information or how often you should or can take the medication in a day. On the inactive ingredients section on the drug facts label, you'll find a list of any preservatives, food coloring, flavoring, or other ingredients not intended to treat your symptoms. Lastly, the questions or comments section gives you the phone number of the company if you have any problems with this specific medication.
Hello, my name is Mimi and I'm here to tell you about how to dispose of your medication. So first I want to say make sure that you put your medication away out of sight right away. You want to store it in a cool, dry place. Often patients store their medication in the bathroom, in a bathroom cabinet, and this will cause the medication to lose its effectiveness. So instead you can try placing it in a kitchen cabinet, in a closet, or in a storage container. Those would be better options. And another thing we advise you to do is to make sure after you take your medication that you make sure the cap is on there sealed tight, and to purchase child-resistant packaging whenever possible. So another question that patients often have is, how do I dispose of my medications when I no longer need it or when the medication is expired? Because just like many other things, medications expire as well. So some tips we have is to mix that medication, mix that tablet or that capsule. Don't crush them. You want to take the whole capsule or the whole tablet. You want to mix it with an unpalatable substance such as coffee grounds, dirt, or cat litter. And then you want to take that mixture and place it in a sealed bag, such as a Ziploc bag. And then you want to dispose of that in your trash can. So now that you've disposed of your medication, you're going to be left with an empty container or an empty package. So you want to make sure before you throw that away that you remove any personal information. And if you're not able to remove it, you want to try to scratch it off as well as possible to make it unreadable. So I hope these tips were helpful.
The last topic we want to cover is how alcohol interacts with common over-the-counter medications. Most medications, whether that be prescription or over-the-counter medications, can cause a severe adverse effect to occur when combined with alcohol. And it's very important for adults of drinking age to know these interactions so that they can continue to treat their pain, illness, or other allergies while staying safe. Drinking alcohol while taking over-the-counter pain relievers such as Advil, Aleve, or Tylenol can cause bleeding, stomach ulcers, increased heart rate, and liver damage. The combination of antihistamines or allergy relief medications such as Benadryl, Claritin, or Zyrtec with alcohol can cause drowsiness, dizziness, and an increased risk of overdose. Taking cough suppressants like Delsum and Robitussin with alcohol can cause dizziness, drowsiness, and an increased risk for overdose as well. When taking alcohol with heartburn and acid reflux medications such as Tagamet or Zantac and other antacids can cause an increase in heart rate and an increased effect of alcohol in the body. Nausea and motion sickness drugs such as Dramamine and Meclizine mixed with alcohol can increase the risk of overdose and cause drowsiness and dizziness. Over-the-counter herbal products like St. John's wort can cause drowsiness, dizziness, and increased feelings of depression or hopelessness when taking alcohol. Thank you so much for taking the time to listen and learn about over-the-counter medication safety. We hope you learned a lot from this video. If you want to test your knowledge on what you heard today, please check out our Jeopardy game that's linked in our website. And as always, stay safe, have fun, and go dogs.